We do have our agenda. Hopefully everybody has their agenda and everything that's in front of them. So Shakira, if you can do a roll call, please.
Okay. Chair Hughes,
Present.
Vice Chair Doe, Vice Chair Doe,
Present.
Treasurer Mullins, or sorry, Treasurer Daniels.
Did you present?
Secretary Mullins,
Present.
Councilmember Crawford,
Here.
Councilmember Dukes,
Here.
Councilmember Winston.
Present.
Okay, that's all council members.
Awesome. So if we can look at the meeting agenda, and if I can have a motion to adopt the meeting agenda.
I move that we adopt
So moved.
the agenda. Well, second the motion then.
Okay, so Crawford, so Carl motion, and then Doe seconded. Any question? All in favor?
Aye.
Aye.
Any
Aye.
opposed? Any abstentions? Okay, motion carries. We do have one item under our consent agenda, which is the approval of the minutes. So hopefully everybody had a chance to look through the meeting minutes, and are there any corrections or additions? If none, I would need a motion to accept our a consent agenda item.
So moved.
Is that Duke?
Second.
Yes.
Okay, so
Second, Alfredo.
thank you. Any question? All in favor?
Aye.
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 Any opposed? Any abstentions? All right, motion carries. We're gonna move to our financial report. And because Councilmember Daniels is new, we had asked if Vice Chair Doe could give our report. So I'll turn your attention to the MFR report, so the manager's financial report. And I know Shakira did send out an updated one, so hopefully everybody was able to see that one.
Yes, thank you, Chair Hughes. I hope everyone was able to get that copy. So as we are aware, we are moving into the second biennium year. So the numbers here look a little bit different than what we had last month. Now I'll call your attention, as you can see on the report itself, the budget items that we have. It looks like we have all the encumbered amounts that you can see in line 3, and then expended amount, which basically those are money that's already we spent out. And if you look at the bottom, I think we got some update as far as what we're supposed to spend out, I believe. And then the unobligated amount, still at 18,172, but there are updated amounts that shows what a full-time salary is going to be like, and the other amounts that are listed below. And unexpended, we have a total of 134,186.72. And again, with the additional amount that you're saying there, it will be 119,231, 119,231 and $18. So basically, that's the snapshot. And when you look at this, we do have it broken down in the other financial reports that you can actually look for particular items if you have questions about that. But the overview is that we're doing pretty well. Now I know there's you'll find a negative number here, but my understanding staff is going to move some funds around to make sure we don't have any negative under the unobligated funds that you see there. But other than that, that's what the financial picture looks like. And later, of course, the executive director will give another picture, basically in a holistic manner, how our funds are being spent and what is it spent on.
Any questions from what was presented? And just maybe more for the newer council members, one of the things that we talked about that you really should kind of look into is really looking at the unobligated. And so we know that there actually is some excess dollars, and part of that was because of staffing dollars that had kind of crossed over when we didn't have staff, so salary savings. And then the other piece to that is because we're in now we're in a new fiscal year, so those funds will have to be expended as of June 30th, 2021. And so we did get a carryover of dollars, but we had quite a bit that we're actually looking into. So there's strategic planning, implementation, and some other aspects, but more so for the newer members of, as you're looking at this report, really understanding what it is that you're really looking at, and then knowing that if you see where we either overspent or underspent, we do have flexibility within the budget where they can adjust the dollars accordingly in between the cost centers. So that's just something to just be able to look at as you're looking at that, because it is probably something new as far as the reporting style. And typically, because it's just a report out, we do not vote on our financials. So there is no vote on when we have the report that's actually submitted. So just a FYI for that. Justin or staff, I know you guys are going to give a financial presentation later, but I didn't know if there was any additional pieces that you wanted to comment on or not necessarily. Okay. So we're going to move, we're actually a little ahead of time, which is fine. But I do see that Dr. Chomilo is on. And so I am going to move to our special guest. And so we will, hopefully she'll be joining soon, but we have invited Commissioner Jan Malcolm and then Dr. Nathan Chomilo, so who is Medicaid and Medicare Medical Director with the Department of Human Services. So welcome. Thank you for being able to join us on the call. So I'm going to turn it over to you. You'll just have to unmute yourself, but I'll turn it over to you to kind of share some information that you have for us. And then from there, I'll open it up for questions from the council.
Sounds good. Thank you all for having me. And I'm a little disappointed in Andre's picture there. We have another bow tie in our midst here, but
I left it in the other room.
So here we'll go. I got a little kind of presentation to kind of go over the role, and then certainly open to questions.
Perfect.
Second. Oh, it says that you've disabled.
So Shakira, you may have to make it so that he can share his screen.
Yeah, just give me 1 second.
Okay.
Switched over. Okay, you should be able to do it now.
Perfect. Okay. So just a little bit about me and my role. And so I'm the new Medicaid Medical Director, which is also important distinction because we also have a new Medicaid Director. and the roles are different in scope, but a little bit about me. So first generation Cameroonian. My dad moved here in the 70s. I've been here my whole life, grew up mostly in Indian Prairie, left for school, and then came back. I've been living in Minneapolis for about the last 15 years. Did school in Ohio, came back and did medical school at the University of Minnesota. I'm board certified as an internal medicine or adult physician and pediatrics, and was a pediatric chief resident at the University Hospital before going into practice at Park Nicollet in Brooklyn Center. And a lot of my practice, and even medical training has involved advocacy. That's always been a part of what my philosophy of what physicians' role is. And so in that, I first got involved in our early childhood and was medical director for a program called Reach Out and Read, as well as on the Governor's Early Learning Council. And so that's where I knew Mr. Dukes from previously. And then I've also been a founding member of Minnesota Doctors for Health Equity. And for me, that kind of journey really came after the murder of Philando Castile, and really wanting to do more in my professional life to address racism in medicine than I was doing in other areas. And so Minnesota Doctors for Health Equity is really physicians trying to educate ourselves about health equity, and then use our position to advocate for changes to address racial and health inequities in Minnesota specifically. And so that work really involved a lot of advocacy to protect Medicaid and how it's funded here, and got me much more familiar with Minnesota's Medicaid system. And so when they were looking to make a switch, particularly with the focus on someone who had that racial equity lens, they approached me, and it made sense because I was able to keep my practice in pediatrics moving to this position. So this position's a half-time role. So I'm in the state's agency role 1 week, and then I go and I'm in clinic for a week, and kind of back and forth. I always find it helpful to kind of just level set about Medicaid versus Medicare, because it is confusing. Even you ask physicians, medical students, physicians along different spectrums of training, and they might have a hard time kind of giving you the details about it. But Medicare is the federally funded program that's nationwide, consistently implemented, that covers mostly people age 65 and older. Some people will qualify for Medicare if they're on disability or require such things as dialysis. And as part of that, it's not all inclusive. So, you do pay deductibles and parts of your costs. And if you ever helped a family member kind of navigate how to sign up for Medicare, all too much about that. And then while Medicaid, and so the plan and part that I'm involved with is both federally funded and state funded. And so most Medicaid agencies have some type of formula where the federal government pays, anywhere from 50 to 90% of the cost, and the states have to come up with the other out of their own budget. And then the coverage and benefit packages is really up to the states. And so it will vary in who gets covered by Medicaid. In Minnesota, it might not necessarily get covered in California, Alaska, Tennessee, what have you. Medicaid is actually predominantly benefiting of children and pregnant women, which make up about 50% of our enrollees. And then we have people with disabilities, and then adults over the age of 18 who have very low incomes. And then most of Medicaid has little or no deductibles or copays, depending on what level you come into the program. And then while both combination of Medicaid and Minnesota Care will cover people with disabilities, some forms of prescription drug coverage and hospital care coverage. So this is data from 2018. Kind of showing how it's broken down in Minnesota. And so we see that most of Minnesotans at the time got their coverage from an employer. That's that light blue. And so the insurance you get with your job. there was a small amount, about 5%, that were on what we call the individual market. So they didn't get coverage from their job, or their coverage from their job wasn't great, and so they went and bought their own. And then Medicaid at the time, and CHIP, which is, you might have heard of, which also is covered by Medicaid and Minnesota Care, was about 14%, with Medicare being about 16%. And then we kind of, again, see the kind of breakdown of the regions of the state. It's pretty equal. Unfortunately, Medicaid has gotten this rap of being something that is only really serving a certain part of our population, only serves inner city populations, but really some of the counties with the highest percentage of enrollees in Medicaid are actually outside of the Twin Cities metro area. And so really statewide, it serves a large number of our Minnesotans. And again, as you can see, mostly children and pregnant women, and then a fair number of people with disabilities. And so this is our kind of most up-to-date. It's not as precise as the others, but based off of the numbers we're seeing, particularly related to COVID-19 and its impact, we estimate that roughly 1 in 5 to 1 in 4 Minnesotans will be covered by Minnesota Care or Medicaid by the end of the year. And so as you can see from 2018, that's a significant jump. And so my role as the medical director, I kind of break it up as both kind of internally and externally. And so internally, within the Medicaid program at DHS, I'm there to provide the medical expertise and guidance. So if there's a new medication or treatment that comes out, what is the actual kind of evidence that it's effective, and have that weigh into whether or not it should be covered under the Medicaid policy. Reviewing and developing policies. And so again, as we kind of think about how can we build coverage and access, are there different programs that we can do to address some of the gaps we see in outcomes? Those are the things that traditionally have come with the role. And then, my particular aspect is I believe I'm there to provide a racial and health equity lens, just given my experience and throughout my work. And so looking at not only within DHS's work, but how Medicaid touches so many other state agencies. And so I think there's really an opportunity in this role to kind of push other parts of our state agencies to also be looking at their work through a racial and health equity lens. And then externally, being a liaison, so kind of working with other enrollees. So enrollees are patients or community members who are served by our Medicaid program, working with the patient advocacy groups and healthcare providers and organizations and insurance companies that care for them, being responsive to legislators, county and city officials about how our programs and impact some of the work they're trying to do. And then working with my colleagues around the country and kind of learning from programs that are working in other parts of the country, but also then helping inform, what's working here in Minnesota that hopefully can help other citizens across the country. So as we look at COVID-19 and our response, gets a little wonky, but there's a bunch of different ways that, since it's a state federal program, to make significant changes, the state agency has to apply to the federal government and get approval. Given the COVID-19 national public health emergency that was issued, that did open up a lot of flexibility, and the federal government has been fairly responsive, at least initially, to helping states create flexibility to meet their enrollees and their community members' needs. That said, we still have lots of barriers, including the increasing number of uninsured, issues with health literacy, how to get information to communities about these changes. How do we continue to deliver things like mental health, substance use disorder, prenatal and pediatric primary care when we're trying to do social distancing, and then certainly just amongst all that, trying to continue to navigate structural racism. Some of the changes that we've made here in Minnesota, more concretely, the changes on the federal level were able to allow us, and actually required to get CARES Act funding, that we could not kick people off of Medicaid. And so, as you might be aware, usually at least once a year, states are required to have people re-enroll and kind of see if they're still eligible for Medicaid. And if they are not, or they don't fill out the paperwork, then they get kicked off. And then, similarly to Minnesota Care, which sometimes requires premiums or copays or deductibles. If someone doesn't pay those, they can get kicked off of that program as well. And so the changes allowed us to basically not have to kick anyone off and not have to do those reassessments of their eligibility during the public health crisis. And so that has allowed many people who might have lost coverage in the last 3 months to continue to have coverage. No cost sharing, again, is those copays or deductibles that someone might have to face to get tested for COVID-19 and get treated. There's been, some understanding kind of frustration because of how billing and coding works, and so that's not always showing up, and so that's something that's continuing to be worked on. But the ideal world is that people shouldn't be paying for COVID-19 testing, and they should not be paying if they're getting treated for COVID-19. And then even using some of those same structures to provide at least free COVID-19 testing for those who are uninsured. Lots of moves to expand telemedicine, and so there were a lot of rules around who could and who couldn't use telemedicine techniques, what technology and what apps and everything that could be used, whether or not you could do telephone visits prior to COVID-19. All of that has been kind of loosened up to allow healthcare providers to reach their patients during all these stay-at-home and shelter-in-place orders. Increase the refills for most prescription medications, I should say. And so prior to this, if you're on Medicaid, you could get a refill for about 34 days at most. And now that's been put up to 90 days. And then similarly to telemedicine for providers, allowing telemedicine for care management and case management services. We continue to have some ongoing, challenges. We've seen a significant drop in vaccination rates amongst children, in large part due to the fact that families were told to stay at home and not come in for their regular checkups. And so working actively with the Department of Health to help get, and their insurance company partners to get word out about that and the importance of getting caught up on vaccination rates. There's going to be some ongoing telemedicine changes as the federal healthcare emergency ends. Some of the flexibility that I talked about will end, and so we'll have to kind of adjust and see what's able to keep temporarily until the legislature can kind of fully reconvene next session and make more determinations on what's going to be more long-term changes that we can make and apply for. And then continuing to get messaging out to communities that are hardest hit. And we did restructure our website to kind of be a little bit more to the point. It was one of the things that I was kind of in people's ears about is that, even for me in the agency and a doctor, looking at our website at first blush, it wasn't very clear how one could sign up for healthcare coverage and how that was tied to COVID-19. And so they did a nice job kind of redesigning that. You can check it out here. And then even really prominently putting references for multiple languages for people to see and access and get help navigating if they need healthcare coverage, if they need COVID-19 testing, all those things. And then, just that kind of messaging going forward, how we kind of reach our communities, certainly the importance of masking and how we can kind of deliver that in a way that acknowledges the extra challenges that brown and black men in particular face masking, but the importance for our community's health is really important to kind of continue to find trusted messengers that can help deliver that message. And then this is just something my wife and I made to kind of deliver to our my kind of Cameroonian community on WhatsApp, just kind of pushing back against some of the myths that I've seen flying around about COVID-19. And so just finding different ways to engage with the community. And then, I came to this role before COVID-19, before I ever knew that was going to be a thing, with a real intent and focus to find ways to really deconstruct structural racism in healthcare, and so through working with DHS staff and grantees, I'm part of Dr. Karen McKinney's anti-racism training, and that's training and kind of talks that I've done and continue to do within medicine more broadly at the medical school and at different healthcare systems and physician organizations, and really kind of push DHS to make decisions all through a racial equity lens. And I think they've been very responsive to that, particularly in the COVID-19 response. I think that's kind of shown us how we can make changes like this, and it's not as daunting as it might seem when you're talking about it. When you look at specific policies and programs, my focus and background is really in early childhood. And so early childhood and maternal and infant health in particular are some of the areas I've really jumped into. And then looking at things like quality measures. And so you might have heard about quality measures in healthcare being like colon cancer screening and diabetes care, things like that. My issue with those measures is that they're kind of the low-hanging fruit. They're the things that systems are built to easily capture, but they don't, I think, as effectively get to the actual patient experience and the actual patient outcome and the disparities that we see due to structural racism. And so how can we better find better measures to capture that, and also using measures as a way to kind of motivate systems to make investments in the right places, because so many of these reports come out and systems scrambled. They want to be the top system with all the measures in the green, and so they spend the resources to kind of design systems to get those measures. And so how can we find measures that get them to address things like their own structural racism? iChirp is a program that I can take no credit for, but I'm very proud to be associated with. It was up and running. It's been going now since 2015, I believe. It's the Integrated Care for High-Risk Pregnancy Initiative that focuses on African American mothers in the Twin Cities and American Indian mothers in the Twin Cities and outside of the Twin Cities. And it's really a community-led initiative. There's a advisory council that kind of helps guide and select the grantees, and they have the ones that developed this hub of wellness. And so multimodal engagement with the community through messaging in different settings, through actually the care that they get during their pregnancy, and connection to doulas or paraprofessionals, connection to other pregnant women in the community, connections for fathers and men coaching, and this is all trying to do it where they get their care. And so the grantees currently are at North Point, West Side. This slide's a little old, so it's Minnesota Community Care and Open Cities here in the Twin Cities. And we've seen a lot of great outcomes from that as far as moms who participate in the program, and low incidence of preterm birth and low birth weight, and then just overall ongoing connections to the community. And so hopeful that even in this upcoming constrained fiscal environment, that this is a program that has kind of shown it's getting at this issue of equity, and so hopeful to continue to get support to not just maintain it, but hopefully expand it. And then lastly, just wanted to touch on some other activity going on in the community that I'm hopeful we'll be able to talk to you about from the state level at some point in the upcoming months. And that's a declaration of racism as a public health crisis. And so I'm really happy that Hennepin County has taken that step with the leadership of Angela Connolly and Irene Fernando. And that's something that certainly on my community side hat been very supportive of, and will continue to do so on the state side as well. And you know, what this really does is just kind of what I've been trying to push a lot of our state agencies and within the Medicaid agency to think of is that we often kind of talk about equity as the wallpaper. It's this thing that we can work on once everything's going well and we got the time for it. But you know, COVID-19 is kind of forcing us to redesign things. And so while we're redesigning and restructuring, how do we build equity into the walls? And these types of statements really make our you know, documents that people have to be accountable to down the road. And so I think that that type of effort, not only in Hennepin County, but hopefully something we can do statewide, will be continue to help us close the gaps on some of those disparities we are seeing COVID unmask. So that's my official DHS Twitter handle if anyone wants to, is a Twitterer, and otherwise I will open up to any questions.
So there is a question in the chat that the infographic that you had shown, wondering if we can have access to that graphic. You can stop sharing your screen if you want to.
Sure. Which the iTrip one?
I believe it was, so Amber had asked that question. I believe it was the one that you said you and your wife had created.
Oh, yeah. Yeah, absolutely.
Because it did have some great information and insight. Yep, so she said that is the one. That was for the
Yep.
one that your wife created, because I think that would be awesome to see. And really, it looked like there was a lot of educational components that were on there as well.
Mm-hmm.
So I want to open it up if any of the council members have any question for Dr. Chomilo.
Yes, I have a couple of questions for Dr. Chomilo. First of all, just want to appreciate the fact that you can be here with us. We see your work as very important that you're doing, and we appreciate the fact that at least you can give us some insight into what you do. I have a couple of questions, and the first one is more of a concern, and what your thought on that. For Medicaid, as you mentioned, that because of the peacetime emergency, people were not being kicked off, right? It continued. One of the concerns that I've learned, or I'm learning in the community as well, is that, of course, Medicaid has a threshold that makes you eligible for the program, which has to do with income, of course, that income threshold. And people receive stimulus income during this period. And they're just concerned that, okay, after the peacetime emergency ends and they're over income for Medicaid, how is that going to impact them going forward? That's one. So how does that impact play into whether their Medicaid will continue? Because that's, they didn't get that income, it was given to them for the most part. So how does that impact the program, the eligibility? And then the second question would be, quickly, just giving your experience, particularly providing racial and health equity lens to the program, how many Minnesotans of African heritage are in the Medicaid program? If you can just give some insight into that.
Yeah, so for the first question, that's a good concern, and one that has been brought up not just here in Minnesota, but nationally. And so the way it's come out so far in Minnesota is that federal funds, so if you got extra money from the federal stimulus package, aren't going to be counted against your eligibility once the emergency ends. Now, I think that the tricky part is if people are like saving that money. I don't know it as well as how they'll kind of tease out whether that's that money that's been accrued from the federal funds over the last several months, or if it counts because it's in the savings account, and so I think that's a piece that I can certainly look into and kind of get back to the council on to report out. And then as far as the numbers for, let me just pull that up real quick. The numbers for enrollment in Medicaid in Minnesota. I haven't committed it to memory yet. I think this is from 2018. So about, in the program itself, 15% of the program is African American. We have 3% that are American Indian, Indigenous, and 6% Hispanic, and 6% Asian. So I don't know the numbers of if we were to look at all of the African American population in Minnesota, how many of them. I just see the numbers that we have on our program.
Hello, Dr. Chomilo. This is Andre. And thank you for being here. Great presentation and great information. I want to go back to your graph that delineated the types of coverage and just ask, what do we have any sense of what the gaps are, particularly as it relates to Minnesotans of African Heritage, and how is that impacting COVID-19 and people having access to care, especially in communities where, we know there are underlying issues and, folks may or may not have insurance, and how's that just impacting, access to care from that standpoint?
Yeah, and so usually the gaps are in adults who are over the age of 18 and make enough money that they don't qualify for Medicaid or Minnesota Care, which is kind of the next level up from Medicaid, or subsidies from the Affordable Care Act, which we didn't even really talk about, but that is kind of the next level up. So they're making enough money that they don't qualify for any of that help, but they don't get affordable or any access through their job that they're working at. Or if they're, an entrepreneur and don't have any to self-insure. And so that's where a lot of the gaps are. I would say one of the biggest barriers from, talking to my colleagues who've been working in the program for many years and been talking to enrollees in the community, it has been what they call that churn of people having to fill out paperwork to stay on coverage. And so the very fact that we aren't kicking people off is actually addressing a lot of the gaps that we see. And that's something that, I'm hoping that we can look at and find out ways, what pieces of that we could, keep and help from that churn kind of revving back up and people getting kicked off who actually would otherwise be eligible. They just didn't get the paperwork submitted at the right time, or they didn't know, I talk about health literacy a lot, which is not only, just your ability to read and write, but it's your ability to know how to navigate the healthcare system. And so we know that that's a big barrier as well, particularly if English isn't your primary language. And so how do we kind of continue to work with some of the community navigators and other groups that have working with communities to kind of keep them enrolled. And so those, I think, would be kind of the biggest issues. And I would say that, that not kicking people off has helped address it the most. But I think the lingering issues would be, again, how do we reach people who would be otherwise eligible? They just don't know that they're eligible. How do we address some of those, concerns that were brought up about, maybe I think I'm making too much now because I'm on unemployment from both the state and the federal government, but actually, no, you would still be eligible. But
there could still be a percentage of folks that, just, you know, don't have jobs, don't have access to insurance. And, you know, as you mentioned, you know, they may not even know that they are eligible, and kind of what is the outreach, what is, you know, the plan to identify who they are, so that, because my, you know, sense is that, you know, because this is such an issue, it's a pandemic, I think that there are high rates of people of African heritage that are being impacted, but, you know, are not, you know, seeking medical health or, you know, help. And so I'm just wondering, like, if there are plans, or, you know, if you have any knowledge of what those plans might be to identify those folks.
Yeah, that is a tough one. And we know that a lot of the times people get enrolled because they show up to the emergency department with some type of health crisis or accident. And that's when they find out, oh, I'm actually eligible, when the hospital themselves helps them enroll. I think it would be interesting idea with some of the kind of mass public testing that we are offering, if there would be kind of, if we continue to do that, if there's a role to kind of see if people at that point are also, you know, enrolled and need help enrolling, that could be a spot to do it too. It's also a little tough because, you know, there's a lot of underlying understandable, you know, I don't like to use mistrust, because it's actually like based in actual abuse and, you know, historical feelings of the medical system. But there's that in the community too, that then makes it hurt. Like, why are you going to see a doctor if you're otherwise healthy? But you're right. If you look at the statistics, both Minnesota and nationally, at when African Americans in particular are showing up to the hospital, they are showing up in later stages of COVID, which means that they either were, you know, misdiagnosed, or they were foregoing care until it got to a point that they absolutely needed care. And so I think we certainly have work to do on that. And that's, you've kind of given me a good idea to kind of see what the feeling is about outreach at those specific kind of public health testing spots.
Thank you.
So there is a question in the chat, but before I go to the question in the chat, I know Commissioner Malcolm, have you joined us yet? I know you were having some internet issues. Okay, she has not joined us yet, so we are waiting for her to still join us. But let me go to this question that's in the chat. This question comes from Councilmember Crawford, who he says, I have some concerns about group homes and the many facilities throughout Minnesota. If we are looking through an equity lens, how are we making sure that people are treated fairly and getting the help that they need during this pandemic?
Yeah, that's a good question and good concern. I don't like to dodge questions, but that's really more in the realm of the public health response with the commissioner. You know, certainly from the Medicaid response, it's been making sure that those homes have access to the same amount of funding, so they can provide things like personal protective equipment, masks and gowns and stuff like that. That they need, and so those are some of the ways that we're kind of trying to ensure that those types of funding and support remain open. But yeah, it certainly is, when we're thinking about how to make sure people get treated equally. It's not just the residents of those homes, it's the people that are working in them, because we know that particularly among congregate care facilities, the workforce is disproportionately Black and Brown Minnesotans.
Okay, awesome. So I do see Commissioner Malcolm is on the phone. So Commissioner Malcolm, can you unmute yourself?
Yes, I think I can. I didn't realize I could unmute myself. I thought you needed to let me in. Can you hear me?
Yes, we can.
Oh, that's awesome. Hi.
Hi.
Let me say hi to Dr. Chomilo. I'm sorry, I caught a lot of what you said, Doctor, and you spot on. So please continue with your questions, but I am here.
Okay, so we're gonna turn it over. We're gonna ask one more question of Dr. Chomilo, and then I do want to turn it over to you, Commissioner Malcolm, because I'm sure the audience and others are real eager to hear, you know, what's going on with COVID and how are we addressing it besides what we see you know, during the governor's press conferences, etc. But here's a question that actually, because we are Facebook Live, so I do want to get to at least one of these questions from Facebook Live. One of the questions that comes and again, this is for Dr. Chomilo, people who qualify for these programs now and become ineligible later, will they have to pay back retro? And if so, will the retro be a lump sum?
So another good question. And my understanding that if you qualify now, and so there's this like term called presumptive eligibility where a hospital could say, you qualify without going and submitting the kind of more formal process. If you qualify, you'll be covered. And I don't believe any expectation of any, usually in normal circumstances, there's not this kind of retro lump sum collection for presumptive eligibility. There's a kind of a period of time, presumptive eligibility usually is only good for about 30 days. And then if it was after that, you might have to pay it. But in the COVID setting, the presumptive eligibility, at least during the federal health care emergency, which is currently in effect and anticipated to probably be in effect for at least another month. During the federal emergency, if you qualify by presumptive eligibility, during that time, you will not have to pay. And then once that switches, you would get notified that you're going through the more formal process, and this is when the clock starts as far as what services are going to be covered or not.
Awesome, thank you for that. There are other questions in the chat, and so what we'll do, like we've done in the past with our other guests, is we'll make sure that we can get those over to you all, and then if you can just respond back to the council, then that way we can make sure that the community knows what the responses were and can follow up if they need to. So I am going to turn it over. I see we have Commissioner Malcolm that has just joined us. Thank you so much for taking time out of your evening to join us. And Dr. Chomilo, don't go anywhere because there may be some other questions for you. But I just want to remind the community and those that are watching on Facebook Live, this was something that we started in January where we had asked specific commissioners to come and join our council meeting as a special guest and just share with us what's going on in the community, but then also address some of the concerns that the community may have. And so we have the Commissioner of Minnesota Department of Health, Commissioner Jan Malcolm, has joined us, and I'm going to turn it over to you to share, just kind of insight about the department, and then we'll open it up for questions for you as well.
That's great. And thank you so much for the invitation. Good evening, council members. I'm really honored to be asked to join you. And I have been having internet problems today. So if you lose me, I apologize in advance. I also don't have a nice slide presentation like Dr. Chomilo did. So, but I was given some of the questions that you hoped I would address. So we'll just have a conversation. I'll try to be fairly brief in my comments so that we can talk about what you'd like to talk about. So again, my name is Jan Malcolm. It's my great honor to serve as the Commissioner of the Minnesota Department of Health. And what we do at the Minnesota Department of Health, or MDH as we are known, is really to work across a very, very broad set of issues to try to prevent health problems before they occur to the absolute extent possible. So prevention is our middle name. And we do that in a wide variety of ways. We try to do that by addressing health risks that come either through things like infectious diseases or environmental health, contaminants in the air, in the water, in the soil. So really trying to do surveillance to look for problems, look for patterns in disease, look for emerging infections, and then try to do what we can to find and control that spread of that risk of that infectious disease or of that environmental hazard. But then also what we work in the area of chronic disease, trying to understand what are the things that create health problems to begin with, that end up creating lifelong problems for people with their diseases that follow them through their life, starting often in early childhood and extending through some of the chronic diseases that are quite typical as we age. So a bunch of programs in chronic disease prevention and best practices as well. We work real closely with our partners at DHS on many of those issues, be they issues of access to care or access to prevention or ways to promote best practices in the provider community and through health education, so that people have the tools to not only navigate the healthcare system, but to hopefully avoid health problems to begin with. We also have a lot of regulatory functions at the agency, as well as health policy functions, trying to promote and put forward policies that will make care better, of higher quality, make it more effective, and make it more responsive to the community. Our mission, our vision at the health department is to protect and improve and maintain the health of all Minnesotans, underscore the word all. Our vision is for a state of health equity, where everyone in Minnesota has what they need to be healthy and every community has what it needs to thrive. One of the things I'm the most proud about at the health department is that we've been studying and talking and trying to raise the visibility around health inequities literally for decades. I had the privilege of serving in this role many, many years ago under Governor Jesse Ventura. So that was over 20 years ago that I first came to the state health department. And when I got there, many of our staff in health statistics, also in what was then known as the Office of Minority Health, had been trying literally for years to get attention paid to the fact that we had known for a long time that underneath, the averages in Minnesota, where we look so good in terms of our average health, we've known for a very long.
Oh, did we lose her?
Okay, I think I'm back. Am I back?
Okay. Yeah, you are.
I was just getting on a roll and then I disappeared. Sorry.
That's okay.
I hope you can see me and hear me still.
Yeah,
my apologies. It's just been a bad internet day. I just cursed by it. So anyway, just the fact that we've known about health inequities for a really long time and have been working to try to raise attention. Back in, I think it was 2016, I believe, or perhaps 2014, the Department of Health published a report which was really quite seminal. And really documented not only the extent of health disparities, where we came to see it's not just disparities or differences, but inequities, structural inequities, really had at the root cause of all those inequities, in our view, was the unequal, inequitable distribution of opportunity, which comes from structural racism. And we use those words, that the root cause of health inequities is structural racism. And that was a bold statement. And we've been working hard and have so much more work to do to act on that insight and that knowledge that the core conditions that All right, I apologize for this in and out.
That's okay. That's okay.
Apparently, it's going to keep disconnecting and reconnecting me. So hopefully, I'll keep coming back. My great apologies. But I wanted to talk a little bit about our history of work in health inequity, because I think it's so very important across the spectrum of health issues, but certainly in the context of COVID-19. I want to also say, this has been such a challenging time for all of us in our community. It's been something unlike anything we have faced in the last 100 years in public health and at the state health department. But I want to also acknowledge across the spectrum of health issues, but certainly in the context of. Now I'm just hearing myself in an echo there. So I hope you're not hearing that as well. Also just wanted to mention that in the midst of the pandemic, we had the significant trauma and pain in our communities through the death of George Floyd. Right in the middle of the pandemic, we have another reminder of another pandemic that we face in our society, that of structural racism. And we know how very important it is to approach our work by really bringing a trauma-informed approach to all of our work. So let me tell you just a little bit about where we are in the epidemic in COVID-19. We can see now in retrospect that we really had kind of a ramp up. We were kind of going along at a fairly slow rate of growth in COVID-19 from the first case that was confirmed by the lab on March 6th. We had kind of a slow, steady progression until about the middle of April. And then in the middle of April, the numbers really started to grow and grow quickly and multiply upon themselves. And then we had a real spike in cases in late April through about the third week of May. And then what we saw after the third week of May, we saw an interesting kind of leveling out in terms of kind of the same rate of growth day over day. And then we started to see a decline in the number of new cases each day. And that lasted until about the middle of June. And then we started to see the cases grow again. And that's kind of where we are now, is back on the upswing. What we hope, though, is that we're not going to go all the way up to where we were in late May, but that we'll stabilize again at a slightly lower level. We've been very carefully monitoring racial disparities in COVID-19. And we have observed, I think Dr. Chomilo talked about this, that indeed people, African Americans, indigenous population, that indeed populations of color and indigenous folks are overrepresented in the number of cases compared to their share of the population. And that's true in the number of cases, it's true in hospitalizations, but it didn't appear to be true in mortality statistics. And while we were glad about that, it didn't really make a lot of sense to us. So we then further dug into the data and began to age adjust the COVID data, and then the disparities were even more stark. And in fact, in the mortality statistics as well, those same inequities do pop up. We do post all of this racial and ethnic breakdown on our health department website, and I hope you can find that a useful data source. It's right on the health department website. You can easily find all the COVID information on the website, which is health.state.mn.us. Pretty easy to find, I hope. And within our State Department, Health Department's COVID-19 response, we have a team that is solely focused on data source. It's right on. We have a team solely focused on ensuring that diverse cultural and faith communities have information on COVID-19, and that health and racial equity is fully embedded within our response. And we have dedicated African heritage community liaisons working with our community partners and ethnic media. We also are working closely and are a part of the Governor's Community Resilience and Recovery Work Group, which is chaired by Chris Taylor, the Chief Inclusion Officer in the Governor's Office. As well, Ku Tao, my colleague at the Health Department, our Director of the Center for Health Equity, is a part of this work group and is on this call this evening. We do continue to see and report and dig in to what is driving these disparities in case exposures, in hospitalizations, ICU, and mortality. So we feel passionately that it's important to report the data and analyze the data through a racial and equity and lens. One particular question that I think folks had was around what to expect this fall as we look at sending kids back to school. And we know that while the health and safety of children is of course paramount, we also know how very important it is for kids to be reconnected to their schools and to the extent possible to get as many kids as we can safely get back in the classroom to have that in-person learning experience. We know that that distance learning just has not been as successful many children in our community, as it has for others, for a whole host of reasons. So it is very much a goal to get kids back into the classroom, but that absolutely needs to be done in a safe way. We know that it's still true, the data still support that children are typically less susceptible to being infected. When they are infected, they tend to get less severe disease, although there are definitely exceptions to that. So none of this is a blanket statement, but just statistically, kids are typically less severely affected. And we know that they do not appear to play a major role in transmitting the infection to others. Indeed, it's not that never can happen. It just it does not happen at the same rates that it does with folks even in the later teen years and on. So this is really important to strike the balance between the value of getting kids, the critical importance of getting kids that access to education is so important for long-term outcomes for all of our kids. But we've been working really closely at the health department with our colleagues at the Department of Education on some guidance for how we can strike that balance and how schools can prepare to return to some form of in-person education, but in a safe way, with guidance around how to make schools less, how to deal with congregation of large numbers, avoiding some of the events and larger gatherings, and just what can make the classroom as safe as possible. So we'll be hearing more about that, I think, in the next couple of weeks here. There was a question on, what are the precautions that particularly we want to reinforce, given what we know about the disparate impact that populations, including those of African heritage, are facing with this virus. And I think Dr. Chomilo mentioned this point too, that one way in which the impact is so disproportionate is that the African heritage community is very heavily represented in essential worker industries, particularly in healthcare, in long-term care, and in the food industry. And so we know that some of what's happening is those disproportionate
Did we lose her again?
I think so.
Okay, that was disconnected a longer time that time.
Okay.
Sorry. It was really testing our patience. My
Well,
apologies.
and what you might have to do, Commissioner, and I know because this has been our life, has been Zoom,
Yeah.
is you may have to stop your camera.
Okay.
And
I will try
sometimes that helps with reconnection issues.
Let me do that.
Okay.
Okay, now I'm off camera, but you can still hear me, I hope, right?
Yes, we can.
All right, let's try that. Thanks for that tip.
Absolutely.
Okay, so we were talking about kind of disproportionate exposures that are happening because of the types of industries that in which folks of African heritage are really heavily represented. And so it's very important that that not only are folks following the basic precautions that we advise for all communities, which is the critical importance of maintaining social distancing. Distance is our friend when it comes to avoiding virus transmission, wearing a mask when you're out in public, particularly in closed indoor spaces, but really anywhere where you can't maintain social distancing, washing hands often. Those are just the core things that all of us need to do. And Dr. Chomilo mentioned, we do understand that there are additional concerns with masking in the African American community and the way that you may be perceived, particularly African American men. And we are very, very much looking for your leadership and your partnership on input on how to how to frame this message, how to have dialogue around these acknowledged complexities. But again, because of some of the higher risk environments in which folks are working from the African heritage community, it's even extra important that individuals get tested, have access to testing and get testing if they are symptomatic or if they feel that they may have been exposed from a workplace setting, from someone you know being sick, from participating in protests or mass gatherings. So, you know, those basic precautions, as well as kind of extra vigilance around testing and follow-up on testing.
So there's a couple of questions that I want to just interject here, if you don't mind.
Oh, please do. That's great.
So one of the questions that is coming, because we're also streaming this Facebook Live. So one of the questions that came out said, what was the racial breakdown of who got tested at each of your June testing sites? So we know that there was free testing that was done at Holy Trinity Church, Sabathani Community Center, New Salem Baptist Church, and then Jimmy Lee Recreation Center.
You know, I'm sorry, I don't have that data at my fingertips, and without an internet connection, I can't look it up. But we will definitely post that information if it isn't already posted on our website. I will make an.
Okay, and then one other question. This comes from one of our council members, Council Member Dukes. In conversations about children returning to school in the fall, there has been some concern that children who are asymptomatic could expose teachers to the virus. How likely is this to happen based on your comment about children being less likely to transmit the virus? I wonder if we just lost her again. We might have lost her. Dr. Chomilo, I don't know if you
Well,
are.
we know
there
from
you are. Okay.
well as what's transpired so far from kids to adults. So and I don't know if Dr. Chomilo, if he's still on the line, if he happens to have any of that data himself, but I can't quote the statistics to you, but it has held up so far quite well that the rates of transmission in school settings is very low, and the transmission that has happened appears to have been among the adults coming in, bringing into the school environment infection that they have been exposed to out in the community. That seems to be the major route of transmission, which again is not to say it can never happen, but statistically far more likely to be exposed from other adults who are.
Yes, so I would agree with the data I've seen that the transmission risk is actually from adults amongst each other and not as great from the children themselves. There's been this initial concern that they would, like we sometimes see with influenza or the flu, that they can be super spreaders and be transmitting it, but that has not borne out in the data we've seen so far for COVID-19.
Thank you for that. Here's another question from Facebook. What specific policies are the Minnesota Department of Health pursuing to combat racism, especially as it manifests as a public health crisis during a global pandemic?
Thanks for that question. Yeah, really. It's a fundamental question. It's exactly right. Let me take this opportunity though to mention, Dr. Chomilo mentioned that discussions that are being had now about declaring racism to be a public health issue, and we too applaud the local leadership that's been bringing this forward, and we are definitely in support of that, of doing that at the statewide level as well. And are doing some research. Some other states and localities have done that. We're looking at kind of what were some of the elements of their declarations. We would want a declaration on this to be, more than just saying this is a problem, because we know it's a problem, but really calling out some of the areas for specific focus. And, you know, I think, again, kind of back to some of the fundamental work we've done at trying to understand what are the root causes of health inequities, whether it's in disproportionate exposure to COVID because of certain workplace environments or certain community conditions. We just keep coming back to the fact that it's not just a matter of individual behavioral choices or individual characteristics, not that those are unimportant, but that the far biggest factor is the conditions in our communities, employment conditions, housing conditions, access to health care. So we just keep on, along with partners such as Dr. Chomilo, really hammering on the fact that we have to work upstream on those community conditions if we expect to see a change and an improvement in eliminating inequities in the outcomes. And really it's the community conditions that are the root cause of so many inequities, not just in health, but in educational outcomes, income security, and so many things that we have to pay attention to. Things like access, access to opportunity. Again, I'll just repeat, whether that's educational opportunity, it's job opportunity, it's opportunity to participate in the community, to have a voice, to influence policy. That those are very broad statements, but we just firmly believe that you have to go upstream into the conditions in communities to really tackle these issues. I think with respect to COVID specifically, as I was just mentioning, and I think your earlier question about, what do we know about who's getting tested, and are tests available to all in our community? If there are unequal or disproportionate exposures, are we reaching community and doing the testing? And I think we need to do a lot more of that. The community testing sites were successful. They showed a surprisingly low rate of positive tests from those tests. That was a good thing. That it appears that at least in those weeks, which we were really looking for, were there a lot of exposures from the mass gathering events around the George Floyd murder and the community, strong and necessary community reaction to that. And we did not see a big spike in infections after those gatherings, and that was good news. But we need to make sure that that people in our communities who are disproportionately being exposed to the virus have access to testing and follow up. So that testing strategy, which we continue to build up our capacity to test, but we need to continue to also get the testing into communities, to have community-based testing, and to work with trusted community partners to sponsor that testing and to help do the outreach to really encourage people to come and get tested, so that is something that the community feels is really responsive to their needs, and is something that they will see as for their community and accessible to their community. So that would be.
Oh no, go ahead. I'm sorry. I was clearing my throat.
No, I think that's such an important and multi-layered question. I could go on all night about it, but.
So let me ask, I got one other question for you, and then I know our executive director, Justin Terrell, has a question for you, but this has come up quite often. If you can tell us, what is contract tracing, and has it been effective so far? And then what additional targeted strategies has the department implemented?
Yes, thank you. That's a great question. So it's called contact tracing. You often hear contract tracing, yes, but it's actually contact tracing. And what that is when we have someone who's been tested and found to be positive for COVID-19, and that person is called the case. So the case investigation includes, interviewing that person and understanding, where might they have gotten exposed to the virus? Was it a workplace thing? Where have they been? Have they been in public gatherings? Have they been at XYZ business or restaurant or what have you? And then importantly, who have they been in close contact with, particularly around the time that they feel that they were exposed. So who were that case person's contacts, and how can we then reach out to those contacts to say, we want you to be aware that you too may have been exposed to the virus. So please be on the lookout for symptoms. Please get tested. You know, and please, if you do develop symptoms, you know, follow the precautions of really quarantining yourself for 14 days, and by all means get tested and get the follow-up care and support that you need. So that's what contact tracing means. And it has been, it is a very important public health tool. It has been successful, but one of the things we are also working on there is designing approaches to case investigation and contact tracing that are really more deeply embedded in communities and done with community partners. So we're working with lots of media partners within the African American and African immigrant communities, as what faith leaders, media partners, health partners, to try to not only make our communications more successful, but to really help us know, well, what is the best way to reach contacts and to reach cases of people, to get testing, to encourage people to be testing, to follow up on the testing, to be willing to engage in this process of sharing contacts, and for the contacts to be willing to talk with the public health folks so that they can get the information they need to get the care they need and to protect themselves and to protect their communities from further spread. So having those partnerships with community organizations to help us do this work is really kind of the next stage of evolving this very critical case investigation and contact tracing strategy, as well as, you know, the very important and kind of education and communication messages that need to be relevant, need to be credible, need to be delivered through trusted community partners in all of our communities, and certainly the African heritage communities. Deep leadership and deep resources just need to be tapped to be part of this more community tailored effort.
Thank you. So I know Justin Terrell has a question for you as well.
Hi,
Good
Justin.
evening, Commissioner. Hi, Commissioner Malcolm. Thank you for joining us tonight. You know, our team listens to your briefings on every day, and it's just great to be able to host you and draw attention from the community to this discussion. And so, and also, Dr. Chomilo, I appreciate your comments as well. Like, it was very helpful. But Commissioner, I just want to say, in my experience at the council over the last 2.5 years, something I've noticed is that the state, and this is not unique to your department, and you know, I've known the health department for a while and worked on some of the systems theory stuff that you guys did a few years ago, and have watched you adopt, you know, language around racial equity and talking about race as a public health crisis. And was happy to see Representative Ruth Richardson introduce a bill yesterday declaring race as a public health emergency, as a public health crisis, and so we'll be supporting that as it goes to the floor next week. But I do have an issue with the way my experience at the state with the departments and the different agencies having deep analysis and understanding of the problem with racial disparities, but then not necessarily moving concrete strategies to address them. And once again, this is not a criticism of your department alone, but one thing that I've seen work and is just setting goals that would take people down a path to addressing the disparities. And so you've talked a lot about different efforts and whatnot, but what goals, and it's okay if it's fine to say that, if you haven't set these goals, I understand, but we need to have a conversation about like what goals have you set for testing in the African heritage community? What goals have you set for supports for essential workers who are exposed to the virus at a higher rate? I mean, that African heritage community, we're over 40% of unemployed, and we're over 40% of the essential workers. That is a crisis if I've ever heard one. And so, how is the health department not just doing the analysis and making strong efforts, but measuring success, which I think there's a question in the chat box that is kind of alluding to this, because we often spend a lot of time on the disparities, but in order to have success in responding to them, we have to set goals that we then can align efforts behind. Is this a helpful question?
Absolutely. No, it's a great point. And we can't just get better at documenting and describing the problem. We have to know how to start doing things that can make a difference. And if your question is specifically to COVID-19, I think that's a fair challenge, and one that we certainly can take back. And I think the work groups, including the Community Recovery and Resilience work group that I mentioned a little bit ago, I think is looking to help us do exactly that, and across all the different dimensions of the state's response to COVID. How do we, the department is, committed, and I think doing a good job of making sure that the data are there and transparent and talked about, and that we are talking about the fact that there are these differences, so that we can target interventions accordingly. But to the extent that we could and should set more quantified goals about how we certainly do now, we do measure the who participates in the testing, so we know if we did not get a representative sample of the community, we know that, and we sort the results by who participated in the testing and what were the testing results cut by racial and ethnic categories. So I think that's important to know what the facts are, but equally important, or more important perhaps, to use those facts to then design how are we going to do more targeted testing, more community-based interventions. So I mean, I don't have a great answer for you in terms of being able to rattle off what the goals are in those areas, but I think as we continue, and sometimes I have to remind myself, it feels like 4 years that we've been doing this rather than 4 months, but we've learned a lot, and we're going to be at this for a long time. So I think these are very, very, very fair and good challenges to us to quantify some of what we're doing with the data that we have.
Just a quick follow-up. And it's more of a comment, but it's just like when community sees the numbers, the data, around how many people are being tested, right? And then, and I haven't looked at the dashboard today, so forgive me if there's been updates around data disaggregation or whatnot, but the data is not disaggregated, and then we don't have a chart to compare it to. So let's say we got like 8% testing at a specific site. Well, what should it be at, right? Like we don't necessarily have the comparison data to be able to say, oh, we have a problem here. Let's mobilize community to do the outreach we need to increase testing from our own constituents. And so a lot of times, without setting a goal and saying that we should have, like in South Minneapolis, the Sabathany site, for example, is in the heart of an old school Black community. And so if we know that, and we know how many Black folks are in that area, and how many adults who are at risk or essential workers, if we know that, we can set a goal for how many Black folks we should be trying to get tested in that area, and work with community to create the demand for that testing. Otherwise, you don't get the influx of testing demand. And then it's like, okay, well, Black folks just aren't showing up to be tested. And I think that, like, I would like to see a shift in the approach a little bit, because our communities need that additional strategy. And I think a lot of times the burden becomes hard to, figure it out. And then I've watched departments kind of walk away from the problem solving process. And what I'd rather see happen is like, just get clear about where we should be and then work with community to help us get there. Is this helpful?
It is. Thank you. I do very much appreciate that suggestion, and I see what you mean. It's easier to kind of rally around something if you have quantified it better. To your point, like what should it be?
Yeah, and I'll just speak to just lastly, real quick. My apologies, Madam Chair. But that's something that's been missing in the COVID-19 response, right? Like the work that your agency has done. I will salute you all day. I think that you guys have been front, transparent, and whatnot. But there has been an element of leadership missing in respect that the most difficult, we've been asked to stay home, we've been asked to wear masks and whatnot, but Minnesotans are capable of doing so much more. And so asking us to if the department sets a goal and asking the community to partner with them to meet that goal, well, now you've just recruited a whole bunch of allies on your mission to keep our state safe. And I just think more approaches like that from our federal government would really be nice, and all the way down to what's happening at the local governments. Now, you guys are managing a pandemic. When I signed up to be the executive director of the council, pandemic was not on my list of things that I thought I was going to have to deal with. And I think like most of us are in that boat. So this isn't a criticism, but it's a challenge as we start to rethink and reimagine how our state agencies respond to the disparities in our community. Simply put, like, we have to set goals and we have to set partnerships to meet those goals.
Thank you very much. I'd love to follow up with you on, get some more of your ideas about the nature of the goals. I appreciate that very much.
Thank you, Commissioner.
We are out of time, but I definitely, on behalf of the council, want to definitely thank Commissioner Malcolm for taking time out of her schedule, along with Dr. Nathan Chomilo. Absolutely appreciate, the two of you spending time with us this evening, answering some of those tougher questions. This will not be, the one and only conversation that we have. Several questions are in the chat. Several questions are on Facebook. What we will do from the council perspective is pull those questions together and then, email those out with hopefully getting a response back from you all. And I would love to invite you all back, probably later this fall, especially when we know we're, looking at this surge. We keep talking about the surge that's coming. And so really finding out, so what have we done since we've had this conversation? But I just want, on behalf of the council, just definitely want to thank you all for spending your time, this evening with us and answering some of those questions. And we absolutely definitely want to have another follow-up discussion. So thank you both.
Thank you. Thanks very much for the opportunity and the suggestions. Look forward to more conversation. Thank you.
Absolutely.
Good night.
Thank you. Yes, you
Thank
have a
you
great
all.
night.
Thank you all for the work you guys are doing.
Thank you. So I'm going to turn it back over to our agenda. And, again, I know that there were a ton of questions spiraling through the chat, along with, I kind of have Facebook going too. And so a couple of those are going as well. So we will, just reiteration for the community, we do gather these questions, and then what we turn around and do is we do send them out, and then we'll find a means to get them back out to community. And it probably will be either through our newsletter that we do, or we can also post something on our social media site so that people can get the responses back to the questions that were asked. So we are now at time where community, are there any community members that want to take a minute and have public comments? Because we do have that open on our agenda. If there are any community members that want to have something to say, if you do, we do ask that you keep it to a time frame of 1 to 2 minutes, and I'd probably say more like 1.5 minutes, if possible. Are there any community members that have any comments that they want to make or any statements? Lakisa, I saw you had gone off off of mute and then you went back on mute.
Did anybody-
Hi, I was trying to look for the hand raise thing. Anyway, I had posted on Facebook about how I think the Department of Health needs to take accountability for what has happened with Black folks in who are being impacted by the coronavirus. And I think they should be asked hard questions about how we got here. Because if you think about like folks who work in factories, folks who work in grocery stores, long-term healthcare, majority of the folks are Black, and you know, we all live amongst each other. So the issue isn't about us getting tested or us not getting masked. It's that we had a really high risk because of the kinds of work that we did. And for a long time, the state was not doing anything. And so the consequences of it means that majority of us are impacted by the coronavirus. And I think when this question of like racism is being asked and there's all these answers that are very theoretical, it doesn't get to the question of why we ended up here and why we are still going to continue being here, because the actions are not proving that the state cares about Black people in any way. And so I think that however that question is posed and what's the responsibility that the state needs to take on has to factor in that they failed us and they continue to fail us.
You just cut out.
Oh, actually, I just stopped talking. Sorry, I don't know how to.
Oh, okay.
Yeah, I don't know how to end.
Stop moving, but then it just, but then there was
I don't
nothing.
know how to end sentences. That was just me stop talking.
Okay, okay. No, but I mean, I think you bring up a good point, you know, and I would love for us to, you know, potentially have additional discussion with Commissioner Malcolm and with Dr. Chomilo, you know, as the Medicaid Medical Director, so that there may be something where we need to think about, is it a panel discussion? Is it something along those lines that we can, you know, ask some of these questions and potentially get the answers that we're looking for? So I appreciate that. Any other public comment?
I wouldn't mind commenting quick.
Sure.
Hi, my name's Khadija. There is a testing site that is being worked on at Phelps Park, and it's coming from community requests in response to the testing sites that MDH initially did, and trying to make, sorry babies, I know it's bedtime, trying to make the testing site trauma-informed, culturally competent, and coming from community. We've been working on that for about 2 months, so know that this is not a fast-moving train as we try to get MDH, I know, and the city to support, I know, to support folks.
Okay.
Mute for me.
Thank you. I did see that there was also something that was posted in the chat. It came from Tom that this Thursday, July 16th at 6:30, Mashali is hosting Minneapolis City Council Ward Candidates Forum, and so that they will be streaming that Facebook Live and YouTube, and the link is also posted here. So thank you for that. There's also a comment from Facebook that I will respond to. I hope the council will look into how to provide resources for people who aren't prepared for at-home care for themselves and loved ones. Thank you for that comment, and that is something that we can look into that. Any other public comment? Okay, so hearing that, I'm gonna move on with our agenda. So we're gonna move to our standing items, strategic planning update. Justin or staff, if you guys just wanna give, I mean, it's probably gonna be a quick 2-second update, but if you wanna go ahead and give that update.
I have a DocuSign contract in my inbox. I will sign it and we will continue with our strategic plan. Thank you to everyone who came to the last meeting.
Yes, thank you. So now we're moving into implementation phase for those that may not know. The commissioner schedule, I'll just remind people that every month we're looking at adding commissioners onto the schedule, and what we're doing is we're having them come talk about their department, but then also we're bringing forth issues that either we have policy around or issues that are greatly impacting our African heritage community. So that will continue on all the way until December, and then we'll start back over with a new set of commissioners as of January. 40th anniversary, either Wayne or Justin, if you guys want to talk about that, because I know we're kind of taking a different twist on that.
Yeah, I'm happy to just speak to it real quick. So we obviously we want to celebrate the fact that we were founded in 1980 and we turned 40 this year, but with COVID-19 we're not able to bring people together in the what it seems could be a meaningful way. So we are still exploring the ideas of council members leading some roundtables with different parts of the community. There's a long overdue conversation around tensions between African heritage community, African immigrant community, and African American community. I know there's a lot of energy around having that conversation, and so that's something we still may be able to pull off in relation to our 40-year anniversary, since the rebrand in 2013 really kind of sparked that conversation. So it's a significant part of the story of the agency. The main project that I'm moving forward on right now is we've applied for a grant with the Historical Society to do an oral tradition project or oral history project. And once we get approved for those funds, we'll we have someone who submitted a proposal that we're looking at working with to help facilitate interviews with past board members and staff to put together an article or report on the history of the agency. So that at minimum, we'll at least have that document to celebrate our 40-year anniversary. However, the timeline is pushed out to probably next spring when something like that will be completed. And so at that point, hopefully we'll also be able to do a convening. So that's what I have. Folks got questions, just due to time, I'm happy to answer offline.
Okay. So I'm going to move to staff. So I know basically you won't necessarily have a director's report, but we're going to move into 3 presentations, our legislative presentation, financial, and then our outreach, and that will take us to the end of the time. So I'm going to turn it over to you all.
All right, then I don't have the agenda in front of me. Which one is queued up to go first? Finances?
Legislative.
Legislative. All right. Jasmine, go ahead, take it away.
Okay. It's not allowing me to share my screen.
Yeah. So Shakira, you're gonna have to make sure that she can share.
Yeah, it's a little bit faster than me. Give me 1 second, Jasmine.
Okay.
It's all good.
Okay, you should be good now.
Okay, thank you. Okay, so hi everyone, my name is Jasmine Carey and I am the Legislative and Policy Director. I'm going to give a brief legislative update on the 2020 session as well as our first and second special session, and then move into a few things that we have coming up that we want to get you prepared for. Here, so with our 2020 session that started in January, the top priorities were around legislation, the supplemental budget, and bonding for the council. Our legislative agenda, the bills that we selected were about 17 bills, and they were either led by African heritage legislators, they were bills led by African heritage organizations, or they were bills that address specific barriers that Minnesotans of African heritage are disproportionately impacted by, whether that's the Crown Act that we worked on, or the sprinkler bill that Representative Noor created in response to the fires that happened in Cedar Riverside last year. But those were the rubric that we used to pick those out. In regards to bonding, our priorities were around the statewide local jobs and projects proposal. So advocating for jobs and for those brick and mortar projects around the state. because of the opportunities that they present and the jobs, as well as the investment in those local areas, as well as the cultural corridors, including the 38th Street corridor, which is a partnership between African heritage organizations, like legacy organizations like the Spokesman Recorder that is on 38th Street, as well as Kente Circle and the Cultural Wellness Center are all working together on that project. In addition to that, the supplemental budget, since this year is focused on policy, it was focused on policy mostly. With the funding that we did have available for supplemental funds, our priorities were around the legislation that we had included in our priorities, including money that goes towards public safety response from a community and police-led partnership, as well as addressing those disparities that still exist in the child welfare system. We haven't been able to move the African American Family Preservation Act. It did not have any hearings last year, but with the supplemental budget, with that money, there was discussion, and we advocated for funding to go to address specific programs in DHS to address the disparities that exist. And in the middle of session 2020, with the COVID-19 pandemic, everything paused, and the legislature shifted priorities. In our role as FEMA, we elevated specific policy recommendations from African heritage leaders and organizations. We sent 2 statements to leadership and Governor Walz, elevating those policy recommendations, but also asking for a meeting and for their support on these specific policy recommendations. That led into 2 calls with the Governor Walz and Lieutenant Governor Flanagan to discuss these policy recommendations. During those calls, we were able to get their commitment to support, as well as follow-up responses that have been presented to you in those internal prep memos around those COVID-19 policies that we've talked about and what work they've done on them and advocated for. Just to go over kind of those areas that we were advocating for were around health. So one of the issues, I just kind of picked one to kind of show, but like an increase in data tracking to better accurately portray how many Minnesotans of African heritages are tested, confirmed positive, and turned away from testing. So kind of what we've been talking about today. One of the main concerns around housing was around rent and mortgage cancellation. That did not happen, but there was that $100 million that the governor and lieutenant governor put out today with the CARES Act money to go to those funding for past rent and rental assistance and mortgage assistance for different counties. Education, just that support for local districts in achieving one-to-one model to ensure students have a computer device as well as access to internet and broadband. With the CARES Act money, they were able to put money aside towards that. And then around economic development, one of the main things we're allocating funds specifically for grants and forgivable loans for small and micro businesses in communities of African heritage. So I'll touch on some of the things that happened, but just a brief update on some of the stuff that happened, especially around the economic advancement areas. So during the end of 2020 session, a lot did not happen. And because of that, and because of the where we stopped at in regards to the response to COVID-19, as well as several other policy issues and the governor's executive powers that were set to expire, he did call the legislature back to special session in June. And during that lapse of time, the priorities were shifted for our agency, but also for the governor and leadership. For one of the caucuses around police reform and accountability, especially that response to COVID-19 and the impact on the African heritage community, and still trying to get somewhere with the bonding and infrastructure investment, especially with the impact in the aftermath in Minneapolis and surrounding cities, with the destruction that happened to businesses and our communities. So advocating for funding to go towards that. During that first special session, there were 3 bills in the House that passed that were on public safety and 5 bills in the Senate. They were not able to come to an agreed upon legislation by the end of session, so there was no police accountability legislation that passed. in regards to economic advancement and labor. There was a $62.5 million bill that passed that was grant money for businesses impacted by COVID-19, which include businesses with 50 or fewer employees. They were able to apply for those grants. Half of the funding went to Greater Minnesota. We were able to get $10 million to go to minority-owned businesses and $2.5 million to support the cultural malls. That bonding bill did not pass the House. For the bonding bill, it needs a 2/3 vote in the House to pass. So it did not pass in that first special session. And because it didn't pass the House, it wasn't able to get voted on in the Senate. So we kind of ended at a standstill with a lot of issues. And because the governor's executive powers were still in power, then he was able to call a second special session that started this past Monday. As a council, we still have the same priorities around police reform and accountability, as well as the response to COVID-19. But like I mentioned earlier, a lot of the CARES Act funding kind of covered some of those areas. So still finding those issues that haven't been addressed. And then the bonding and infrastructure investment, because the bonding bill still hasn't been passed. Right now, it has gone through committee in the House, and they're hoping to get it to the floor to see if it can get a vote to pass. And that should be happening, hopefully. The House is in session right now. They don't have any bills on the agenda. They've been making amendments. But the Senate is going to reconvene on Monday, July 20th, and we're hoping that a lot of things will be passed at that time. Just some highlights that I wanted to point out of some bills that have been introduced this past week. We have HF 1 and SF 37, that is by Representative Mariani and Senator Hayden, and that includes all the police accountability, which includes oversight, arbitration changes, and everything. There were several provisions that were heard in the first special session, and there were those 3 bills, and they kind of put it into one bill. So that has been introduced in the House and in the Senate, as well as Representative Hassan and Senator Torres Ray have created a bill around the Promise Act, which will be creating community repair panel to consider the claims and determine awards. So going outside of the bonding to see if there's any money that we can get towards community, as well as Senator Champion introduced expanding a bill that would expand ban the box, which includes boards, commissions, and other similar entities. Right now at the state of Minnesota, that question is still asked. So even like with this council, people are prevented, depending on their background, from being able to apply with the ban the box not being in there. And then HR 1 that was mentioned earlier around the resolution declaring racism as a public health crisis. So that was introduced by Representative Richardson, and it was heard and passed through its committee that it needed to go to in the House. So then it should hit the floor, and hopefully it's around that July 20th. There hasn't been a resolution since today that I've checked out that has been introduced in the Senate. So it has been introduced in the House. And so just getting to that, we'll talk about more of this stuff, as well as some additional things at our session debrief that we have taking place. That's going to be on Tuesday, July 28th. So the last Tuesday of the month, and that is going to be from 6 to 8 p.m. It is a virtual event like this meeting. It will be streamed online and recorded for future viewing. So we'll be able to get that out to everyone who's not able to attend live that day, just because the information is so pertinent, especially depending on where we end with the second special session, as well as we all know that there is election this year, and every seat in the House and the Senate are up. So hearing where our African heritage legislators, the issues that they worked on, as well as what passed, what didn't pass, and getting that breakdown and answering those questions. So the first part of the event is going to be a discussion really on that 2020 session. We don't want to skip over those bills that kind of got lost by the wayside when COVID happened. So tackling that, and then a committee report, but then also I have to talk to our chair, but kind of using the structure that we've used today, been having a conversation with our African heritage. I would like her to lead on, the legislators' response to COVID-19, the murder of George Floyd, as well as touching on those first and second special sessions in those areas that we've been advocating for, and seeing what happened, what didn't happen, and getting that update and answering the community's questions. So my ask for council members is if you guys have any questions, if you could send me 1 to 3 questions around those areas, around special session, around the legislators' response to COVID-19 or any special interest that you have. So then that way we can cultivate an agenda and a program that is in alignment with, you know, what the council wants to know and what what you're hearing from your community about the issues that need to be addressed, and as well as inviting community members as well as your network to this event. And please share on social media. So we have been posting. You can reshare it, invite everyone to the event online. But we really want, especially there isn't an event that takes place with all the Black legislators, all the African heritage legislators, and puts them on a platform where they're able to explain what's going on, what the impact is, and answer the questions. So it's a great opportunity, and we want everyone who's to be present, available, and if not, we'll send that information out so they'll know what was discussed and what those issues are.
Any questions for Jasmine from the council members? Awesome job, Jasmine. That's a lot of good information. So hopefully everybody can come out to the debrief virtually from 6 to 8 on the 28th. So financial presentation.
I just forgive me, I've been in back-to-back meetings today, Madam Chair. Did members get the slides that Jasmine put together?
Well, you know what? No, I don't think we got Jasmine's. I know we got the financial presentation, but I don't think we got Jasmine's. So
Jasmine,
we'll just make sure we send that out.
Okay, thank you.
Yep. And let me just apologize in advance because of the guests that were, you know, we kind of allowed questions to go a little bit longer than normal. So we probably will run a little bit over our council meeting tonight. So I recognize if people can't stay past, you know, 8 o'clock, I understand, but we'll probably run at least 10 to 15 minutes past normal time just for tonight because of, I didn't want to cut off that conversation with the commissioner and the medical director. So go ahead, Justin.
Yeah, so Shakira is going to present on the financials. I'm happy to answer any questions about the financials, but Shakira is going to present just sort of the raw data.
Okay.
Go for it, Shakira.
Okay, hold on one second. Let me just get this set up. I will try to go through this as fast as possible.
I want a blue one.
All right, I'm going to try to go through this fairly quick. If you have any questions, feel free to stop me. If you have like really micro or finite questions, please send them to me. I'd be more than happy to answer them that way so we can kind of cut down on time and have time for Amber's presentation as well. Okay. So real quick, Mission of the Council. Basically, shortened version is that we are charged with making sure that people of African heritage in the state of Minnesota fully and equitably benefit from the policies and procedures of the state of Minnesota. Quick reminders. Apologize about the noise in the background. Okay, so some context for fiscal year 20, for last year. We did get an increase to our budget, which allowed us to increase our office space so that we were able to have the full suite. And also, we were able to shift our FTEs from 3.5 to 4.5 FTEs, which then allowed us to be fully staffed. Another context for fiscal year 20 is COVID-19, as well as George Floyd's murder. So a lot of things going on. Our goals for this year were to kind of increase for food sponsors to increase our capacity in the building and to get that extra space, which we were able to do, as well as be able to shift over to 4.5 FTEs. What that basically meant is that Jasmine's position got shifted from a part-time position to a full-time position. We wanted to get our prompt payments up to about 97%. We are on track to meet that. Unfortunately, I don't have updated numbers for you. When I reached out to admin to get the prompt payment numbers, he ran it, but it only went back to about April. And as of April, we were at 94%. So I do anticipate us being able to get the extra couple percentage to make that 97% mark. We wanted to increase our staffing, which we did. Wanted to classify some of our positions to be a bit more competitive, which we were able to do with Jasmine's position going from a director to going from a coordinator to a director position. We also wanted to develop an internship and a volunteer program. We were able to do an internship through, we were able to do an internship, and that's how we were able to have Natasha from January until May. And we are anticipating being able to repeat that in the fall. Okay, so quick review, you can see the appropriations for the past 2 bienniums. So we have fiscal year 18, as well as fiscal year 19. Then you can see the jump from fiscal year 19, where we were about here at about 40, it's like 46 and 465. And then we did a good jump up here to fiscal year 20. So we went from being the least funded council of any of the councils that are ethnic councils to being the most funded. And we'll continue that thread all the way through this fiscal year. We are still on top. It's not as big of a margin between us and the second highest being UCLA, but we are still having a great impact there. Okay, so you can kind of see our budget a little bit more closely. With what we were allotted, we jumped from $403,000 for a budget appropriation in fiscal year 18 over to last year of being at $531,000 and this year being at $532,000. We do have a little bit of carryover funds, which I will evaluate on a little bit later, but not quite as substantial as we did in fiscal year 19. Okay, so this is the salary versus operations budget. You can see that a lot of our budget is going towards salary, which is typical of a small agency. At 61%, operations is about 39%. Contracts for last fiscal year, we spent about $27,000 in contracts, which ends up being only about 5.3% of our agency budget, so of small amounts. The contracts that we did were mainly APAs, or annual plan agreements. So we did photography, we did communications, we had our strategic plan, which was an inter-office plan. We had our annual report writing, and then we had our 40th anniversary logo creation. For fiscal year 20 events, we were able to do our session debrief, our community policy summit, our annual meeting, our day on the Hill. And then we're continuing to do legislative training sessions virtually. For fiscal year 21, we'll see how many of these we're able to repeat, but we did get good feedback from the community that they really enjoyed having that community policy summit and our annual meeting, in addition to having our annual day on the Hill. Fiscal year 20 events, you can see we spent about $20,752, which is only about 44% of our agency budget. You can see that most of our budget per event was spent on our day on the Hill, which is our biggest event, followed by session debrief, and then our, followed by our annual meeting, our policy summit, our session debrief, and then our day on the Hill, day on the Hill lunch. Okay, so for fiscal year 21, we are looking at another, well, possibly having impact because of COVID-19, everything being virtual versus physical, so we'll have some different costs incurred there. There is also a state budget deficit, As a result of that deficit, we may possibly have budget cuts. We don't know quite yet, but we will find out sometime soon, I would anticipate. Because of that, what we were going to do is we're going to try to have money set aside to cover that in case we do end up having a budget decrease. So then that way we're able to still keep our agency fully staffed. And then the remainder of the carryover funds will be used for different projects that we have been making. Okay. So salary operations for fiscal year 21 looks pretty similar to fiscal year 20, where salary is in the 60s and operations is in the 30s. Again, this is typical for an agency of our size. So contract for fiscal year 21, we're looking at a legislative survey, photography, the oral history project that Justin touched upon for the 40th anniversary. That is pending a grant being reviewed. We're hopeful that that will cover costs for that. And then we have our annual report, which will be due in January. Communications will be ongoing, and then our strategic plan. Any questions? I know I kind of worked through that.
Questions from the council? I do know, from the state perspective where you were saying that there may be budget cuts, I know there's also a hiring freeze too. So I don't know if people, are unaware of that, but I do know that that was one of the things that is, right now there's been a hiring freeze. So we don't know if that's going to impact anything at this point in time as far as the council is concerned. And then also just kind of a reiteration, more specifically for our newer members, is we're not necessarily a program-driven agency, which is why you're going to see our operational costs that are going to be, I would say it appears to be skewed because we're mainly driven from the salary. Salaries are going to be a little bit higher than our operations. And that's partially due because we're not necessarily a programmatic agency, where we're program-driven, so to speak.
I got a quick question. So Madam Chair, my question is, yeah, Justin, could you, the grant for the Historical Society, can we get an idea what that dollar amount is? Is there a dollar amount we're looking for, or are we just open to what they can give us? Just considering what we want to use it for, it'd be important to get some idea.
Yeah, Madam Chair, Vice Chair, though, we applied for a $10,000 grant, which is what the oral history project would cost.
Okay. So I'm assuming that the oral history would include, as far as what we discussed in terms of the council, the period of the council, and also the period of how the demographic has changed and the contribution we made as people with African heritage, right? That should include everything, hopefully.
I'm not sure I caught the question. The oral history will cover, I think it's going to cover like 10 interviews, and we'll have that go with transcription and the whole nine, and we'll have that go from we'll interview current members, past staff as well.
Yeah, I'm saying that because we also mentioned the impact of just how our demographic changed in the state of Minnesota in terms of African immigrants and merging into the society, and what kind of impact that has had over the years. Should be something that we reflect in history, because I think it shows basically how the council is interacting with people of African heritage in general.
So that I wanted to clarify that oral history project will not cover like a demographic summary of the state. It will cover, it will focus on people who have been associated with the agency to get the history of the agency and the work of the agency. And so there will obviously be, it will be reflective of the group that the agency has been made up of. So there'll be African immigrants, African American folks. We may talk to a couple legislators. I know that Senator Herr who was from the Hmong community, served for a while, represent Senator Dan Hall, Rena, so we will have a sample of folks who have served on the council, but it's not like a report of the statewide African heritage community. It's really about the work of this body.
Right. No, I understand that when we say the work of the body, who are they serving in terms of the people, the demographic? Not necessarily the history of people coming, but the work that the council has done over that period and the people that they serve. But we can talk about that, I guess, more.
Okay.
Okay.
Yep.
Any other questions? So let's move to our last item. So the outreach presentation.
Thank you, Madam Chair. I do not have slides, and I'm going to be very brief, as you all got the outreach report, I think last week. So I'll be very brief, but this is just a preview of what is to come this summer, focusing on outreach for summer 2020. And this is typically the high point of the year when it comes to outreach. Typically in a non-COVID year, we would be doing multiple events throughout the state or supporting or being visible at community events to really hear what the issues are in African heritage communities. And since we are in the House, we have to change up our strategy. So this summer, we're going to be hosting 4 roundtable discussions, 2 in August and 2 in September. And we're focusing on issue areas that affect African heritage communities that the council has identified, council staff has identified as issues that the council either needs to kind of build up our strategy around a little bit more intentionally, or because of what is happening in our community and where some of the large issues in our community currently. And so those 4 issue areas are around education, around public safety, around economic development and revitalization, and around public health. And then on the outreach report, there are tentative dates for those. I did take your advice, Madam Chair, and we did move the dates to Thursday afternoon. So thank you for your suggestion. So those dates did change to August, I cannot speak, August 6th, August 20th, September 3rd, and September 17th. And we're looking at the 4 to 5:30 range. So as we have these virtual conversations, we really want to make sure that we are really being able to have the conversations that we need as a council with community leaders across the state and across the diaspora that can further inform our 2021 legislative priorities. So there's a lot of great work happening in the community with different organizations that are having these virtual conversations about the issues. We don't want to step on their toes. We do need to have a conversation directly with our community about how the state can step up in particular to address some of the issues in our community, since that is our line of work. And so that is going to be the focus. We're going to talk about the state of affairs, but then also about potential policy solutions that we can pursue specifically at the state level. And then this is going to inform our work as we go into our fall policy summit, where we convene our community members to help construct those legislative priorities going into 2021. As far as the asks to the council, we are asking for council members to consider being a co-host to a roundtable discussion. It's not a heavy lift. It's really just, being my co-host on the roundtable as we engage in these conversations. I'm looking for 1 council member per event to participate, to give greens, and to support and contribute to the conversation from your vantage point. I already know that Council Member Nandi already volunteered for the Economic Development and Revitalization roundtable, so thank you. I'm still looking for a co-host for education, public safety, and public health. And on the outreach report that I emailed, you can, there's information on how to contact me to express your interest. Specifically for the education one that is coming up soon, that's on August 6th. So I really want to nail down that information as soon as possible. In addition, I really want to make sure that we have strong representation both across the state. Thank you, Chair Hughes. I want to make sure we have strong representation across the state when it comes to our community experts, as well as across the diaspora. And so if you have recommendations for community experts to serve as panelists on these roundtables, please reach out to Justin with that information. Your connections, your networks are going to be essential. And as we start to promote, please also take some time to promote these roundtable discussions as well. We will be streaming them on Facebook so people can tune into the conversation. So are there any questions about the roundtables for summer outreach?
Amber, have you all already set up, like, you know, how we've been doing the invitations, how we have it for the session debrief? Do you have similar advertisement for these roundtables?
That is to come as I start to nail down panelists.
Okay, because I was gonna say that would be, you know, another way for us to share on our own personal social media websites along with our other networks as well.
Mm-hmm. Absolutely.
Okay.
Can I chime in just real quick?
Yeah.
Madam Chair, we won't do like the full, like we're doing KMOJ and Chalet for session debrief. We won't do that for the roundtable. So we'll really rely on folks to use social media tools.
Okay. No, that's good to know. Any questions for Amber?
Thank you, Vice Chair Doe. Okay. If there are no questions on that, the last thing I just briefly want to talk about is our Greater Minnesota outreach. And so one of my core objectives in my role is to really strengthen our network in Greater Minnesota and to really focus on the cities of Duluth, Mankato, Rochester, and St. Cloud in particular. We have had some really great conversations these past few weeks. And I'm also taking over our monthly statewide calls. And so I'm using that as an avenue to really convene our partners in those areas to be able to share their work and to figure out how the council can support their work and also how they can be looped into the work of the council. I'm also trying to increase our turnout to council meetings as well from representation throughout Greater Minnesota, so that we can continue to hear what the issues are and how those issues are showing up and how things are being addressed by the community leaders in those areas. Just to kind of give you a highlight, I don't know if you all have been following some of the work coming out of Mankato, but they are forming a new NAACP branch, and there's a lot of energy in the Mankato area, a lot of folks who are running for local office there, school board, things of that nature. There's a lot of energy and activity coming from the African Heritage community to really be leaders in their local community, and we want to support that. In addition, we've been having multiple conversations with the Rochester community along similar veins as well, and they have a lot of interest in working with the council more directly. And so we want to make sure that as we are building our legislative priorities, as we're continuing our work as a council, that we have a broad and statewide focused agenda to our work and really making sure that we integrate the perspectives from Greater Minnesota throughout all facets of our work. And so we're really excited for what's building in those areas. And thank you to the council members who have been helpful and just supporting that work. I know I've talked to Council Member Crawford at least once to kind of build out my relationships in the Duluth area.
Awesome, thank you. Any questions for Amber on that, what she just presented? And I know you also can see more, you know, in-depthness with the report that was also sent out too. If you guys have further questions, don't hesitate to reach out to her. So hearing none, any announcements that anyone has?
Madam Chair, this is Jude. It's not an announcement. This is just a general comment. I know we've been talking about the impact of COVID in Black community, and we've had a commissioner come to us 2 times. So I'd like us to, I will talk with Justin later, but I would like us to follow up with them. So the impact of COVID is so profound in our community, and different organizations, they have set up a task force to fight COVID, and it's just within the community, the more they can do, volunteer through their meetings, through organizations, but they don't have resources to fight COVID as they want to do. And the Department of Health, they have mapped out some resources, community engagement, media, and others. But in most cases, as far as I know, they don't get to every community that we represent. So I would like us to follow up with them after this presentation and after the talk. We really need to follow up with them and see how we can, put effort together and put something, resources available to these communities as they fight COVID. So I think this will fall to the staff and Justin, but I would like us to do something as soon as we can before the next meeting or before we meet with the health agencies again. So we really need to do something to the community, and the impact is so profound. So I just wanted to make that comment. I don't know how to pursue this, but that is something that we need to consider and put our presence on the ground. Thank you.
Okay, no, thank you for that. Any other comments? Announcements?
This is Afreda.
Yes.
This is a comment / question. I'm not sure if the council have the ability to do to put something out there, as far as a lot of our workers, Black and brown workers, are heading back to work or are at work already, and we know that most workplaces or work conditions are not safe, especially those who are working within the healthcare field. I'm talking about nursing homes and group homes. And take, for instance, like it was like about a month ago when Sin 3s, which have majority of African immigrants who work there, was one of the places that had the highest rate of COVID, and our workers were unprotected. So how can we put something out there as people are preparing to go back to work in different industries? And most of the industries that are populated by Black and brown folks are not given priority as far as safety. So what can a council do, whether it's whether it's like putting a word out there or something, to stand in solidarity with the workers, but also let them know we're here for you, and work with employers to make sure these environments are safe for our communities?
Justin, you were gonna say something?
Yeah, thanks, Madam Chair. Treasurer Daniels. If you want to give me a call tomorrow, let's just talk about it and figure out what makes sense. We did an outreach presentation with DLI today, and I think that DLI has some work to do around this topic. I'm one of the mind, though, to say that when it comes to getting information out to Black workers, as much as I wish we were the best resource for that, I don't know that we are. And so figuring out who actually has the reach to get the information out is a question that I would have. And how do we push folks to get that information out? Some other things we can do is put together a statement. We can, organize a call with groups that work with Black workers, and figure out what is it that they need us to advocate for. To this point, without getting too far down a rabbit hole, I got a call from Nalima last night at 10 o'clock, and talking about some concerns for some Black workers that she's working with, and so I'm advocating for them right now. And so I think you're hitting on a crucial point. So if you just I'm pretty open tomorrow if you want to give me a holler. then we can just, you know, spend some time talking about what a strategy could look like and figure out a way to actionize something. So is that helpful?
Sounds good. I'll give you a call tomorrow.
Or shoot me an email tonight. Oh, it's your call. All right.
Either works for me.
Yeah.
Well, hearing nothing else, and I know I appreciate you all hanging in with us because we are way past time, and normally y'all know me, I start on time and I end on time, but because of the information that was given today was why we kind of ran over. So if hearing nothing else, if we can have a motion to adjourn.
So move, Daniels.
Second.
Motion to adjourn, Madam Chair.
All right, thank you all. We are officially adjourned. You guys have a